Children and adolescents with physical and psychiatric diseases are obviously more vulnerable. Children and adolescents who have developmental disabilities are definitely more vulnerable. And children who are in broken homes or at-risk environments definitely become more and more vulnerable. So and it also brings us to a question that is staying home equivalent to staying safe? Gradually, I'm going to discuss more about this, but for now, let me say that in abusive homes, in homes where adequate caregivers are not there, or the caretakers that were there available with the family are not around, and children are being neglected or emotionally abused, sexually abused, physically abused by others. Because school, a regular routine, their friends that were all a part of their social well-being and a part of their social network is just not available to them. So I'm now going to talk about children specifically from 0 to 3 years and the challenges of being, so you can understand the newborns are already are challenged by being born in quarantine times because there is inadequate caregiver structure, losing out on ceremonies, celebrations, rituals, induction into family, the homecoming, the little rituals that are there when the family welcomes a baby. So many people go to visit the mother and the child at the nursing homes or at the hospital. That is not going to be there. The mother who has just given birth is always so scared. She's also in a more vulnerable state. The family members who are taking the child and the mother, bringing them back from the nursing home is also feeling that, they are entering a high-risk environment, losing out on ceremonies and celebrations like any induction ceremony where, generally the elders of the family would be there. Now, the first people we would want to leave out from these ceremonies are the elders because they are more at risk, we know. Vaccines are getting delayed. There is a lot of confusion whether we should go for the vaccines at all now. And obviously, you understand that all the state health facilities that would provide vaccines for free to children from the government setup are also shut because all the OPDs are shut. So what is happening to these children? Are they going to suffer because of this, because of loss of vaccines? Acquiring baby food and supplies initially was a huge problem during the lockdown because even stores that were keeping baby food, there was inadequate supply, and because a lot of people had hoarded a lot of baby food and supplies, so there was obviously an inequity and it was not enough was available for others. Loss of outdoor routines, like I said, the child cannot go out to play, cannot go to a nearby park, cannot go for cricket coaching, cannot go out to be with friends and generally play football or just generally hang around, go out cycling. All of these are lacking. So there's a loss of outdoor routines, a lack of context of the change, because especially for young children, they are also failing to understand the context, that why they have to be at home, why they cannot go out anymore, why is it not safe to visit the neighbors, why cannot his grandmother and grandfather come and stay with him, why does his father now remain at home. So there could be children could be gaining weight, there could be TV and screen time for preschoolers, which was not allowed earlier. A number of schools, I'm told, are doing a lot of online classes, even preschools. So in different states, that has been barred. Like in Maharashtra, for example, there is the government has barred all online activity for children who are below the second standard, but not in all states. So a number of schools continue to do that. So parents are also in a dilemma whether the child, should be exposed to so much screen time and TV time because they are at home. Parents need to manage them, so they're also trying to figure that out. For preschoolers and young learners, what is happening is there is homeschooling. There could be inadequate structure of homeschooling in the sense that people who are schooling them may not have the adequate patience or education or capacity to be training the children. Online classes are happening, again, online classes are happening for a certain section of the children. Not all young children are getting online classes. Say, for example, the government schools are not having online classes. There is a digital divide that is coming about. To do or not to do the classes. Often, I would request all of you to please
ऑनलाइन क्लासेस
be on mute.
ऑनलाइन क्लास की सबसे खास बात मालूम क्या है? आप रिकॉर्ड
Sanjukta, could you please ask everybody to be on
Please
mute?
stop presenting your screen. What is the name? Extremely sorry, ma'am. I just checked.
Could I request the participants to please be on mute?
Please stop.
You know, this
Please
is a
stop.
webinar, and if you are continuously talking, you could be talking and sharing your views. But could we do this after the presentation? Can you see my screen again, Sanjukta? Could you please guide me? Can you see my screen?
No, ma'am. No, ma'am.
Just a minute.
Ma'am, it's not visible. The PPT is not visible, ma'am.
Just a minute. Is it visible now?
No, ma'am.
Not yet?
No.
Yes. Ma'am, not on the power, like slideshow mode.
Yes, not on the slideshow mode.
Yeah.
I will do that.
Okay.
Is it visible now? Then I will just go into the slideshow.
Yeah, yes, the PPT is visible.
Okay. Now it is okay?
Yeah, it's absolutely.
Yes, that's fine.
Thank you.
Perfectly fine. Go ahead, ma'am, please.
Thank you. We know that initially there were a lot of reports coming in how online classes were getting disrupted by hackers, how on Zoom other people had access to online classes, they were threatening people, they were bullying young children. There was a class in a very, very reputed school of Calcutta, and these students were bullied online, where hackers threatened to kill them and showed pornographic content to them. So the parents are also at a glitch whether to let the child do online classes or not to do classes. I already mentioned about the major lack of extracurricular activities or online mode of extracurricular activities. Again, they are not going there, they are not bonding, they are not with other children. If we think about school, all that I can remember about my school, I mean, other than my teachers, is obviously, and a great part of it is my friends and how they miss their friends. So there is no interaction with friends and peers, missing school, missing friends, missing teachers. More difficult to manage indoors because obviously the child who is not getting any outdoor activities, not getting any physical exercise, is also becoming more jittery around the house. What is happening to the tuition teachers? Are they also teaching online? Then how much time are you going to give to screen time? It's just going to go up and up. Gadget and screen time is a major concern. And obviously a missing routine. Like, you know, you can, even for your online classes, typically it is not starting at the time when school would start. So the children are actually going off to bed much later, getting up much later, joining their classes much later. Young children who come to me are also telling me that often they, you know, log in for their class and they go right off to sleep, and they keep their videos and audios on mute. And as long as they are logged in, they get their attendance, and then they are not attending. So this is becoming a problem, and it is a major challenge even for teachers. So this is a study by Forza on behalf of Save the Children. And they are saying that what are children thinking about during the coronavirus crisis? 76% miss their friends, 59% are naturally bored, 38% enjoy having more time with their family, but 13% also feel lonely, and 7% were scared. So concerns about children and families, the top concerns that they do not know how long this will last was bothering 64% of the parents, And 60% of the children, that they and their children can't go to school, was bothering 50% of the parents and 47% of the children. But not seeing their friends was bothering the children the most, 85% of the times. And they were feeling trapped at home, 26% of them said that, and that their parents, that they can't go to work, 8% of children were bothered about that. Now, if you look at adolescence, online classes, I also mentioned about online bullying. There's a lot of victimization because adolescents are more active on social media, and even social media victimization is very common now. There's a lot of bullying, and because people are making more posts and there are more videos of performances and everything, there is also a lot of trolling that is happening online. And like I was saying, that the inequities in the society are also becoming extremely pronounced, in the sense that the students who were going to government schools, they have not been going to school since March. The children who were going to private schools are getting some access to digitalized education, online classes, online tuitions. So that is further pronouncing the inequities, relationships and friendships, what is happening to that, because adolescents are more attached to their friends and their peers and the cohorts. So change dynamics also of the home atmosphere, because like I said, that the parents are also at home. If it is an abusive home, if it is a broken home, then the conflicts are actually becoming more and more. Understanding the struggle of the parents, their employment status, the finances, because adolescents who are in the formal operational thought would actually garner more information about that. They would want to know. There is a sense of isolation, a sense of despair, internet usage, game addiction, online streaming of content. I will come to studies about this a little later. And also uncertainties related to examinations, entrances, semester schedules, all of that is bothering them. So in abusive environments, what is happening to children and adolescents? I'm using a poster that was set out by Swayam. Swayam is an NGO that works for women and against violence that are meted out to women specifically. So this is their poster. It just speaks for itself. And obviously this problem has been intensified by lack or absence of support from broader social networks and the community, that the friends that they could reach out to, the teachers that they could reach out to, the neighbors that they could reach out to, they cannot anymore. Pandemics and its challenges for special students. What do I mean by that? Children with special needs. Homeschooling them is becoming very challenging. Screen time for children with special needs. How much screen time do we give to children with special needs? Or even children with attention deficit hyperactivity problems. So that becomes a problem. Monitoring children with special needs. I will just give you an example. One of my old clients called me up and said, ma'am, we have told our child that all buses and trains and all other means of travel and touring is absent completely. And we would take these trips every 3 months. And this is a child with autism. And for them, structure is very important. Their understanding of social exchanges are limited. So they were saying that, he was telling me that I have told him I cannot even take him out for a bit of a walk to the road, because if he sees that buses are plying and that there are regular buses and taxis moving around, he will again want to go somewhere. And it is so difficult because we don't have our own car to actually expose the child to a public vehicle would be so challenging. So how do we handle this? So these are problems that are coming up. These are very specific to the pandemic situation. Children who it has taken years for parents to actually get them into a routine of getting up in the morning, taking a bath, getting ready for school, would actually, I have heard stories where children who of special needs and their school are telling us that children would get up, get ready, and wait to be taken to school. And when they are not being taken to school, they are throwing a tantrum or are, becoming extremely aggressive, not understanding that, these are special circumstances, and these are circumstances where schools are shut and you cannot be taken there. So I was talking about behavioral addiction. So what is happening? Behavioral addiction is basically any form of addiction to internet, to gaming, to binge watching media or series. So Netflix, gaming, porn addiction. Dr. Manoj Sharma, who's the Enhance De-Addiction Center, said that the rise has been about 30% in terms of addiction, and the de-addiction they were working well with de-addiction because of, again, addiction. I mean, again, even parents are providing, to the children the devices, the gadgets, because there is nothing else to do, and the child is naturally again getting hooked to these things. And substance abuse is also on the rise for adolescents. Increasing viewing pornographic content by minors is also happening. So there was a study conducted in China, which has been published in May 2020, where the medical college, by using questionnaire packet that included a scale on generalized anxiety disorder, and it had 743 respondents, showed that 2.7% had moderate level of anxiety and 21.3% of mild anxiety. And understand that this mild anxiety is significant at clinical levels. So living in urban areas, family income stability, living with parents with protective factors against the anxiety, whereas having relatives or acquaintance infected with COVID was a risk factor for increasing the anxiety among college students. And correlation analysis showed that economic effects and effects on daily life, as well as delays in academic activities, were positively associated with anxiety symptoms. We all know that how sharp rise there has been in cases of self-harm, suicidal attempts, and death by suicide in minors. This is a Kolkata police number that 113 cases of suicide were reported, and more than double the number for the same period last year. But the main problem actually lies not in there, but in our overall understanding of mental health. So 1 in 5 of us will actually have a mental disorder during some time or the other of our life. But only 2% of the government's money is spent on the national health budget to mental health. And that results in more than 80% of people whose need for mental health services globally all over lack the reach to mental health care. And the number, this particularly I am interested to show you, that ₹4 per capita government expenditure is there on mental health. And the number of people who are in need of mental health care is 150 million. So this is a huge, huge inequity. The pandemic has actually just worsened an already wobbly domain of mental health. The human mind and our lack of care for mental health is being highlighted now during this hour of crisis. Even when help is there, very few reach out, as there is no culture of highlighting mental health. Still, I would say in the pandemic situation, I'm getting to hear about mental health from other disciplines, from people who are, taking this opportunity to create some awareness. A lot of colleges have come up with creating this awareness where they are talking about mental health in this aspect. But there is an overall lack of mental health literacy. We do not know the first thing about how to take care of our mental health. A lack of concept of the psychological first aid. And obviously, there is also a lack of professional care. So I will just briefly touch upon some strategies for children and adolescents and thereby end my presentation for today. So what are the things that we could do? Firstly, I would say just understand that it's okay not to be okay. These are very difficult times. I said that unprecedented times. Don't expect normal reactions. Even for parents, I would say that this is very important for you to remember. So So the World Health Organization has a fantastic book which is available for free. It is an illustrated guide and it is extremely helpful if you want to take a look at it. It is free to be downloaded, Doing What Matters in Times of Stress. And it talks about how it is important to ground ourselves, to savor each and every moment, to be in the present moment. Because the past is gone, we will not be able to change it. The future is so unpredictable, there is no point trying to predict it. Acting on our values is going to be important. We have to realize that if we are doing something, is it taking us away from our value system or is it bringing us closer to our value system? You know, when I am being very unkind to my neighbor who has tested positive, please try and understand that is it something that is taking me towards my value system or is it something which is taking me away from my value system? Being kind to self and others is important. Unhooking self from the emotions. There are a whole lot of emotions, like I was saying, that even during a day, there is a plethora of emotions that we are going through. It is important to unhook. We need to make room for all kinds of feelings. It is okay to understand that it is okay to feel like crying in the middle of the day, although there was nothing that actually went on during the day. But we've been doing it for so long. There is a sort of exhaustion and tiredness that has come in. Meditation can be helpful. Mindfulness, being in the moment, doing each and every activity with 100% of your attention can be good. And it is also a great time for children and to teach children to pick up new skills, to pick up life skills. If there still is a lot of staff that were regularly employed by us, domestic staff, has not been coming, or you have asked them not to come because you do not feel safe about, letting others enter the home. So could the children be taught some life skills, like, preparing the dough for the chapatis, or laying the table, or filling up the bottles with water, helping to clean up afterward. So these are very important life skills that even children need to know, and it can actually help them to overcome stress because they will feel more useful. So with this, I would end my presentation. Have a great mental health day every day. Give something back, relate to people, exercise your body, appreciate your world, and try something new. Thank you.
Thank you so very much, ma'am, for such an informative lecture. Participants, if you have any questions, you can put them in our chat box.
Am I audible to all? শোনা যাচ্ছে আমাকে?
Yes, ma'am.
Now it's time to our second speaker, Professor Sadhan Dasgupte. Professor University of Calcutta. I want to say something about sir. Sir had 35 years of teaching experiences. His research area is clinical psychology, positive psychology, adolescent mental health, LGBT crisis, etc. He guided 10 PhD candidates and has 40 publications in different national and international journals. Sir completed research projects from UGC, ICMR, ICSSR, DST, right? Professor Dasgupte delivered lecture in Sigmund Freud University, Stockholm University, Cape Town University, Rajshahi University, Dhaka Jagannath University, etc. And Sir was ex-Senate and syndicate member of Calcutta University. Sir, you can get started and very warm welcome. Sir, are you here?
স্যার মিউটে আছে, স্যার মিউটে আছে।
Sir, your microphone is muted, sir. Koushik, can you hear me?
Yes, yes.
Koushik,
Sir?
just inform, sir.
Hello.
हाँ
Hello.
sir.
Hey, now
Yes sir, yes sir.
audible?
Yes sir, yes sir, you are audible.
Okay, okay, okay.
Yes sir, yes sir.
Yes, sir.
Thank you so much. So I can start now.
Welcome, sir.
Okay. At first, I convey my regards to the principal and vice principal of New Alipore College, my dear teachers of the college, and especially the staff of the Department of Education, and all my dear participants. Today, I shall speak on the impact of COVID-19 on adolescence. Actually, you know, the World Health Organization, or WHO, defines an adolescent as any person between the ages 10 and 19. It is a transitional stage between childhood and adulthood. According to many social scientists, adolescence is the most turbulent period of our total lifespan. This is so stated because we know that different kinds of biological and psychosocial changes occur during this time, but the adolescents do not know how to cope with those changes. And they are really in a dilemma about their own mode of behavior. They do not know what pattern of behavior will be accepted by the adult members of the society and which one will not be accepted. Sometimes we have seen that if they behave like an adult person, then the society will say that you are behaving like an adult person. And in Bengali term, in the language of Rabindranath, I must say that they will say Jethamo hocche. And if they behave like a child, then they will say that Nakamo hocche. So they are very much confused regarding their own mode of behavior. They do not know which form of behavior in them will be accepted by the society. But it also be mentioned here that what type of stress or how much stress the adolescent will feel during this time of pandemic, that will depend upon different kinds of situations, because it is not acting, it is not affecting all adolescents in the same pattern. So what are the different factors that I must mention at first, which are very much important for developing stress within an individual? The first thing is the level of general intelligence and the emotional intelligence of the child. The second point is, that is also very important, that is the parental support they are getting from their home. The third one is the peer status of the adolescent. And next one is the coping skills of the adolescents, which they have developed within themselves. And lastly, the pre-pandemic mental state of the individual, that is also very much important, the pre-pandemic mental state of the individual, or whether this adolescence has any history of different forms of mental illness before this pandemic. This present pandemic situation is creating stress amongst all of us to some extent, irrespective of our education, irrespective of sex and ACS. We all are passing through a stage of uncertainty. Especially in case of adolescence, it has appeared as an added stress. It is true that adolescents are not directly at risk for development of COVID-19 symptoms. That is very much true. But this pandemic has significantly disturbed their lives in other ways. So As per my observation, in this present pandemic situation, three main factors are creating stress within the adolescents. The number one is the social distancing. The number two is the interruption of typical school routines. And number three is continuous stay with the family members. All of these have become very much challenging for them. First, I shall discuss or talk about the impact of school closure on adolescents, because we know that since last February or the first week of March, all the schools are closed. All colleges, universities also are closed due to these pandemic situations. So all of the students are staying at home. The first thing is that they have to spend 24 hours with the family members, which is not at all pleasant for them. They are constantly facing conflict with elderly family members on trivial matters, which is hampering their freedom of existence. Secondly, what we have seen that as they are not getting proper exposure with their friends and peers in school, they can't share so many personal things with them. They cannot share any personal issues with them. And they cannot share those things with their family members or guardians also. As those issues are remaining unsolved or unresolved, they are reflecting through different forms of behavior in the home situation, which sometimes are not accepted by the guardians. Thirdly, what we have seen that we have observed there are two very important tasks of adolescence. Number one is development of social skills and empathy. What do you mean by that? For example, the resilience capacity of the adolescents. Resilience means how far quickly the adolescents come out from a stress situation, whether they have developed it within them or not. Secondly, the relations and sexuality, exploring of romantic relations and sexuality, and the development of cognitive empathy through interaction with the people. And next one is also very important, that is the sense of identity. This stage we know is very important because here the sense of self develops within the adolescence. So considering all these things, we have seen that these all these skills develop within the adolescents through the interaction with their peers, and disconnections from social outlets and peers will have some implications when they will return to their social settings after lockdown. Definitely, it will leave some impact on their later social and emotional development. Due to this long time abstinence from schools, adolescents from LIG community are also facing more stress and trauma than the other adolescents who are coming from MIG or HIG. In addition to academic stress, they are also facing problems with their food supply, housing instability, loss of family income, higher rate of death and illness in their community. Regular abuse and interpersonal violence at home situation are also reported by them regularly. Next one is, in this context, I must mention about the crisis faced by the rural adolescents in context to their access to education during this pandemic. That is also very important. Most of the people who we are staying in the urban situation, we can't imagine their situation. We are talking about the online classes, online seminars, etc. And these are also going on in the urban setup, but you do not know what is their condition, and they are not in a position to reach all these things due to the lack of facilities in their setup. While well of urban school students are attending online classes, sitting for the examinations, most of the rural adolescents are deprived of these facilities. In urban setup, this is beyond our imagination. We cannot think about it. So right at this moment, I think digital India concept is an utopian idea. Unfortunately, we, the urban dwellers, cannot even imagine their troubles. A recent state representative survey on the rural adolescents have confirmed the following issues. Number one is only 5% live in a household that owns a computer. Second point is what we can get from this survey report, that between the age 10 and 14 years, only 1 to 6% adolescents have their own mobile. Some adolescents have access to a family member's mobile phone, but they may not be able to get it for a prolonged duration. And another important issue is the uninterrupted internet access. That is also a very crucial problem for them. So these disparities between the haves and have-nots are becoming very prominent during this lockdown. So what are the most probable consequences of this situation? What we can find from this? The probable consequences are, number one, a large section of girls will drop out or will be forced to drop out from the school situations when the schools will be reopened. Secondly, for this section of children, no school meals, no midday meal, no iron and folic acid supplementation, and no sanitary napkin distribution. They will be deprived from all these things. Most of the alarming issues are increasing rate of child marriage, increasing rate of family violence and abuse by family members as children are within their grip for 24 hours due to the school closure. And it is noted, it is reported that they are becoming the victim of different forms of sexual abuse and violence in their home situations. And that is very much unfortunate for them. The most dangerous issue is that under such conditions of school closure, school closure and lockdown, adolescents are not getting any scope to report all these things to their peers or to their teachers. They are not getting any outlet. Who can take some action against it? So they have to succumb all these situations within their home situation. The second point, which is also very, very important, I think, that is the conflict with authority. Continuous conflict between the autonomy and compliance is another source of crisis during this lockdown. And that is a very common conflict. And in normal situation also, we have seen that this type of conflict, that is between the autonomy and compliance, is a very common conflict in case of adolescents, because the adolescents think that they are mature enough and they can take their own decisions according to their own way. But the guardians, on the other hand, they think that they are not mature enough and they still need their close guidance. In most of the Indian situations, most of the Indian parents prefer to monitor not only the study schedule and career choice of their wards, but they also like to monitor their personal life affairs, which is definitely hampering their well-being and happiness. And under this lockdown condition, these problems are aggravating day by day. And most psychologically, most important thing is what I have seen, that these are creating a breach of trust between the mother and the child, between the parents and the adolescents. Another important issue under this pandemic condition is that parents are becoming very much stressed, very much high strung regarding the future career of their adolescent children. What will happen to them? What will be its solution, like this? And they are transmitting their anxiety, their depression, their frustration onto their children. And as a result of this, they are also, the adolescents are also getting very high strung. All of you know that this pandemic situation will not continue for a very, very long time or for the whole life. Okay, one day it will be solved definitely. Maximum what can happen? That they can miss 1 year. But it is not more important than our life. So we have to develop within us our tolerance for uncertainty. It will definitely be solved one day. One day our schools, college, university, everything will be open, and we will again come back to our normal educational system. But at present, what I have seen from different guardians, that they are becoming very much high-strung regarding this issue, and they are transmitting their own anxiety and depression on their adolescent children. Another important issue which we should discuss here, that is the increasing rate of suicide or deliberate self-harm during this pandemic condition. Conceptually, we know that suicidal behavior includes suicidal ideation, planning suicide, attempting suicide, and suicide itself. So it starts with the suicidal ideation. Like other pandemic conditions, in case of COVID-19 also, the rate of suicide amongst adolescents are increasing in an alarming way, not only in India, but all over the world. Following are the most potential reasons for the development of this condition, as it is reported in the daily newspaper or in the journal communication. What are those issues, or what are those factors which are increasing, or which are rather playing as a positive factor behind the development of this suicidal condition? Number one is they can't attend virtual classes due to lack of facilities at home. In most of the cases, especially in the rural areas, in urban areas also, I have seen that they are not in a position to attend the examinations or the regular classes, as they don't have any smartphone. Recently, in an institution, I have taken examination in a postgraduate diploma course. There also I have seen that there are certain students, they could not attend the examination through online as they don't have any smartphone. Okay. So the second factor is the continuous conflict with authority on trivial matters. As I have mentioned already, that is also an important issue or important factor for the rising rate of suicide amongst the adolescents during this pandemic condition. The next one is loss of family income due to loss of job, creating stress and consequent depression also amongst the adolescents, because this is also a very, very common phenomenon, especially in the public sectors. So when they can see that their parents are losing job, they can be depressed and they will be frustrated and they will suffer from different kinds of mental problems, and that is very natural because everything is becoming uncertain for them. They do not know what will happen in the next day, how they will get food, what will be their future. Everything are becoming uncertain for them in this situation. The next one is the growing feeling of loneliness and social isolation that is also creating depression amongst the adolescents. And the next one is due to school closure, they are missing social support from peers and teachers of school, all of which act as stress buster in different crises of their life. That is also very important issue. Furthermore, what we have seen that in case of a previous pandemic also, this suicidal rate becomes very much increased in case of non-clinical population also. That is very alarming, what we have seen, that it is also very much increased amongst the person of non-clinical range of mental distress. So here we can assume that the persons who have already a suicidal ideation or who are suffering from depression, they will be more vulnerable in these kinds of situations. So every time in all my lectures, I am always saying these things, that the persons who have this kind of history of previous mental illness, who are taking these drugs, please don't discontinue your treatment during this lockdown condition. It can develop different kinds of problems within the individual. And my last point is, I think most of the people, they are not considering, they are not thinking about this population, this marginal population. They are also suffering from stress during this pandemic condition. That is increased minority stress of adolescents from the LGBT community. Okay? In the heteronormative culture, especially in our Indian culture, they are already suffering from minority stress in each steps of their life. Am I audible? Hello? Hello?
Yes,
Hello?
sir, you're audible, sir.
Okay. In each step of their life, they are suffering from minority stress. This present pandemic situation and the social isolation are creating added stress to them for the following reasons. Number one is, as they are forced to stay at home, they are continually becoming the victim of taunts and torture. Tease, taunts, and torture from the family members. Sometimes they are also becoming the victim of sexual abuse by elderly male members of their family, because from different interview, from different data, I have got this, because I have done so many works in this particular area. I have got this impression that they think that this kind of activities towards them, they take it as a part of their treatment for changing their sexual orientation. But from our knowledge, we know that these kinds of orientation cannot be changed. And there is no treatment for changing these kinds of orientation. When it is developed and the persons with these kinds of orientation, we can support them. What we can do for them, that we can support them so that their minority stress can be minimized, so that they can develop or express themselves with the potentials with which they have come in this world. Nothing more can be done with this kind of population. And the next problem is many such people from this community are at present working with different restaurants, different food services, different beauty parlors, and gym centers. All of these things are closed due to this pandemic condition. Probably gyms have, or gym centers have probably opened yesterday or day before yesterday, maybe. So, due to the closure of these centers, they are losing their jobs. They are suffering from financial crisis also, and these are creating stress amongst them. And another thing, lastly, that is the reduced access to community support and support group counseling are also certainly creating stress amongst them, because they cannot, due to this lockdown condition, they are deprived of this condition. They cannot go for counseling. They cannot meet their peers support group. So due to all these things, they are suffering from stress. And another more important issue is there are a large number of adolescents who have HIV positive infection. Okay, so in this condition, they could not access their treatment facilities or medical facilities, which are also creating tremendous stress for them. So I have discussed here different points which are very much important and creating stress amongst the adolescents under this pandemic. And in my conclusion of this presentation, I will say that although this COVID-19 situation is creating stress on us, and all of us are suffering from anxiety, depression, etc. to some extent, undoubtedly we can say. But at the same time, I must say that we should try to come out from this situation. Because if we don't try to come out of this situation, our immunity system of the body will be lowered. And that will again create different kinds of problem, and that will make us vulnerable for the development of different kinds of symptoms, including the COVID symptoms, very easily. So we must try to come out of this situation by engaging ourselves in some meaningful activities. History says that these kinds of situation does not continue forever. And I hope that this time also we will be able to come out of this pandemic situation and we will enjoy our normal life again. So today I will end my lecture with a very, very famous line of Rabindranath Tagore, that বিপদে মোরে রক্ষা করো এনহে মোর প্রার্থনা, বিপদে আমি না যেন করি ভয়. Thank you everybody. Thank you all. If you have any question, you can ask me. I am very comfortable to answer these questions.
Thank you, sir. Thank you for this insightful lecture. We are really enriched by your lecture and really glad to have you. No, sir, there is no questions. Thank you so very much, sir.
Okay.
Now we are going to our third speaker, Mr. Partha Pratim Roy. Mr. Partha Pratim Roy, clinical psychologist, specialized in child psychology and case management. Roy has published so many books like শিশুদের পড়াশোনা, সন্তান প্রতিপালনের মনস্তাত্ত্বিক চাবিকাঠি, ব্যক্তিত্বের অসুখ ও নিরাময়, etc. Mr. Roy is advisory member of Behala Noboproyas and founder member of Psychogenesis Research Foundation and is the guest faculty of Ramakrishna Mission Shiksha Mandir, Belur Math, Howrah. Sir, very welcome. You can get started.
Yes, Koushik is there. Koushik.
Yes, sir.
আমি এখান থেকে একটুখানি আমাকে দেখে বলবে যে দেখা যাচ্ছে কিনা। আমি এখান থেকে খুলছি এখন।
ঠিক আছে স্যার, আপনি খুলুন, নাহলে আমি করে দিচ্ছি।
আমি একটু জাস্ট প্রেজেন্টেশনটা খুলতে একটু সময় নিয়ে নিচ্ছে। তোমার ওখান থেকে প্রেজেন্টেশন খুলে ফেলতে পারবে?
ওকে স্যার, আমি প্রেজেন্ট করব কি?
তুমি আমি দেখছি একবার, কারণ এখানে খুব একটা ভালো রেসপন্স করছে না। আমি
স্যার ফার্স্ট স্যার প্রেজেন্ট নাওতে ক্লিক করুন স্যার।
হ্যাঁ, প্রেজেন্ট নাওতে করছি।
তারপরে স্যার ওই এন্টায়ার স্ক্রিন।
আমি করছি। হ্যাঁ, এইবারে মনে হচ্ছে দাও। এবার কি গেছে?
নো স্যার। স্যার এন্টায়ার স্ক্রিনে ক্লিক করার পর একটা পপআপ আসবে, তারপর স্যার ওই স্ক্রিনের মধ্যে ক্লিক করলে তবে স্যার শেয়ার অপশনটা অ্যাক্টিভ হবে।
হ্যাঁ, আসলে এটা খুব ভালো রেসপন্স করছে না, যে কোনো কারণেই হোক।
স্যার আমি কি করে দেব?
তুমি ওখান থেকে দেখো তো, খুলে যদি দিতে পারো। আমার কাছে থাকলে আমার নিয়ন্ত্রণে থাকতো। তোমার ওখান থেকে তুমি চেষ্টা করো, যদি হয়ে যায় তো ঠিক আছে। কারণ আমার এখান থেকে করছি, কিন্তু এটা
সংযুক্ত দিদি, you can see my screen.
Yes.
Now the presentation can visible?
Yes, it is visible.
Okay sir.
আচ্ছা, আমি দেখতে পাবো?
Yes sir.
হ্যাঁ, তুমি তাহলে স্ক্রিনে দিয়ে দাও, দেখে নিচ্ছি।
স্যার পিন অন মাই ট্যাব স্যার। স্যার আমার নামের উপর পিন করুন, তাহলে আপনি দেখতে পাবেন।
হ্যাঁ, তোমার নামের উপরই আমি পিন করছি, কোনোটাই রেসপন্স করছে না। হ্যাঁ, এবারে হচ্ছে মনে। এখানে স্ক্রিনে দেখাচ্ছে কৌশিক দাস ইজ প্রেজেন্টিং।
হ্যাঁ স্যার।
চলো।
ওকে স্যার, নাও ক্যান স্টার্ট স্যার।
আমি কিছু দেখতে পাচ্ছি না, একটু দেখে নিই। মানে আমি কি তোমার কৌশিক দাসেই আগে একবার ক্লিক করব? মানে আমি স্ক্রিনে দেখতে চাইছি।
হ্যাঁ, স্ক্রিনে স্যার আমি পাশ থেকে যে অপশনটা আসে সেটাকে নিয়ে বের করে ওখানে আমার নাম আছে, ওখানে আপনি আমার নামের উপর ক্লিক করলেই স্ক্রিনটা দেখতে পাবেন স্যার।
আমার এখানে এসেছে কৌশিক দাস ইজ
হ্যাঁ,
প্রেজেন্টিং।
দুটো আছে স্যার, একটা নাম আছে, একটা আছে কৌশিক দাস প্রেজেন্টিং স্ক্রিন, ওইটায় ক্লিক করুন স্যার। কৌশিক দাস প্রেজেন্ট স্ক্রিন, ওইটাতে ক্লিক করুন স্যার।
প্রেজেন্টিং নাও। আসলে এত মানুষ, এত সব পার্টিসিপেট, মানে এত নাম ঢুকে পড়ছে ওখানে। ধরো আমার এখান থেকে হয়ে যাবে মনে হচ্ছে।
Hello, sir. Talk in English.
হ্যাঁ 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 ঠিক আছে, চলে এসছে, আমি দেখতে পাচ্ছি।
ওকে স্যার।
গুড
না
ইভিনিং।
না
হ্যাঁ, good evening everybody, and it's a really great pleasure and honor to be a part of this program, and I thank you all the personnel of Education Department, New Alipore College. So today my subject is psychological effect of COVID-19 on old age. Next, দিয়ে দাও। Next slide. Actually, COVID-19, it's a we can consider it's a new era of coronavirus, because coronavirus is ruling right now the entire world, and we are under the rule of coronavirus, and it is affecting in every sphere of our life, in every sphere of our society. Change করে দাও একটু কৌশিক, next slide এ দিয়ে দাও। effect
আমি পুরো ব্ল্যাঙ্ক,
this
আমি পুরো ব্ল্যাঙ্ক, বুঝতে মানে আমি তো আমি
আবার এসছে,
স্ক্রিন শেয়ারটা দাও না।
আবার এসছে কৌশিক, আবার এসছে।
ওকে
So effect of this in this pandemic situation and effect of corona, particularly there are কৌশিক, হ্যাঁ আছিস করো না কৌশিক, আগেরটা দিয়ে রাখো, আগের স্লাইডটা। হ্যাঁ, actually the corona is affecting Koushik, should I continue?
Yes, sir.
Koushik?
Continue.
Yes, sir. Yes, sir.
Actually, the corona has affected the entire children population, and already there are a lot of discussion. We are every day through television, on the paper, there are a lot of discussion on children, how they are being affected by coronavirus, and we are learning about the adolescents, we are learning about the adult. So thousands of pages, the newspaper, they are writing about the adolescents problem, children, the problem of the child and problem of the adult, but they are spending less time, less pages on old age population, because we have the very less amount of information or less information about the old age population, how much they are suffering in this pandemic situation, and what is the actual effect of COVID-19, and what kind of psychological problem they are suffering from. Next idea. So the first 30 days of lockdown period, particularly after March 27 or something like that, the lockdown started. So first 30 days, it was the honeymoon phase. There was no as such problem, because everybody, we enjoyed that first 30 days. In the famous book of Karl Marx, Das Kapital, there is a chapter, The Working Day. And he mentioned the 24 hours, out of 24 hours, 8 hours for work, 8 hours for rest, and 8 hours for entertainment. But during this lockdown period, first 30 days, the entire 24 hours we got for entertainment and we got for rest. But actually, we started to feel what is the consequences of lockdown and what is the consequences of the effect of coronavirus. We started to realize after 30 days, when this particular honeymoon phase was over. Next, Koushik. The real coronavirus, the corona crisis starts after 30 days. Then after 30 days, we start to realize actually the adverse, what is the adverse effect, what is the color and taste of the adverse effects of COVID-19. Next. The old age crisis.
Hello.
Please.
Sir.
Please, microphone গুলো একটু যারা প্রশাসনে আছেন, those who are organizer,
Please mute.
please put all of your microphone in the
Please muted
silent
your
mode.
microphone, all participants. Please muted your microphone.
Otherwise, it is creating noise and I cannot hear my own voice. Please, it is a request. And if it is possible, you just switch off your the video also. You can see me. You can see me. You can see the presentation also. The old age crisis is mostly invisible because already I mentioned previously that if you switch on the TV, always there is a discussion.
Hello.
I don't know who is busy with microphone testing. So if you switch on the TV, or if you open the page of the newspaper, always you will be finding the crisis of the children, crisis of the adolescents, and crisis of the adult. But there is less discussion about the old age crisis. Mainly it is invisible. We cannot find what kind of problem they are facing in this pandemic situation. Next, Koushik. The list talked about. There, the problem is already I mentioned from the beginning that their problem, we don't know what is the actual problem of the old age people. And nobody is discussing about them, and most of the newspaper and the electronic media and the printing media, they are busy with everybody and everything except this old age. So they are invisible. Not only invisible, their problem is we don't discuss. In this seminar, I'm grateful really that at least this organizer, they have kept a place for old age people. So next, Koushik, change the why is talk why আবার একদম প্রথমে চলে গেল why is less talk and why the problem is invisible, because most of the electronic media and most of the newspaper, because all those areas are the great source of information and awareness about the COVID-19 and how COVID-19 is affecting the human life and how it is creating the new normal and how it is destroying the normal rhythm of the life. Always everything they are discussing on the base of the children, they're discussing on child, they're discussing on adolescent, they're discussing on adult, because it is sellable, it is very lucrative, it has got sale value. But discussion about the old age people, it is not that much of lucrative, it is not that much of palatable. It does not give any the interest to us. What is the purpose of listening all the problems about all the problem of the old age? So people don't feel like any interest. So newspaper also and the printing media also and the electronic media also, they don't bother about the old age people. But it is really unfortunate. So this is also one of the reason we know less problem about the old age people. To change kore dao. Next is because another important point, the old age people mostly they looked after by their adult children and sometimes and partly by the grandchildren. They also look after their grandfather, grandmother, and the adult person also. Suppose I look after my own father and own mother. This is the tradition of Indian, the conventional, or it is the tradition that we have to look after our old the parents or grandparents. But the main problem is that the change korata. The main problem is that Koushik, the adult.
Sir, PPT is not visible.
बिल्कुल आवाज आ रहा है।
PPT is not visible.
Koushik,
सर आवाज
Koushik PPT বলছে দেখা যাচ্ছে না। Koushik, are you there?
Koushik
PPT টা দেখ।
Yes. PPT is not visible. Sanjukta di?
PPT is not visible. PPT is not visible.
Okay, okay, I'm again share my screen again.
একটুখানি অ্যারেঞ্জ করে দাও।
Now Sanjukta di?
Yes, yes, yes. Now it is visible.
হ্যাঁ, আমি দেখতে পাচ্ছি না। এখন পরপর সিরিয়াল করা আছে।
Sir,
now it is visible.
আমি কি ক্লিক করব?
Yes sir, yes sir.
প্রেজেন্টেশন?
Yes sir.
হ্যাঁ, আমি করছি। মানে যতগুলো তোমার নাম আছে যেখানে যেখানে আমি ক্লিক করে যাচ্ছি। আচ্ছা, নিচে একটা এসছে কৌশিক দাস ইজ প্রেজেন্টিং, একটা তীর চিহ্ন, ওটাতে করব?
Yes sir, yes sir.
তাহলেও দেখাচ্ছে না। উইন্ডো এসছে, ক্রোম ট্যাব এসছে, ইওর এন্টায়ার স্ক্রিন এসছে।
No sir, সাইডে গিয়ে আমার নামে যে কৌশিক দাস শেয়ারিং স্ক্রিন সেটাতে ক্লিক করুন।
একটা এসছে কৌশিক দাস প্রেজেন্টেশন, কৌশিক দাস।
হ্যাঁ, প্রেজেন্টেশন।
আচ্ছা, এবারে এসছে, মানে আমি দেখতে পাচ্ছি, তোমরা দেখতে পাচ্ছো?
Yes, we can see.
ঠিক আছে, কৌশিক একটা দুটো, হ্যাঁ the same thing, খুব কেটে কেটে যাচ্ছে, খুব ডিস্টার্ব হচ্ছে। Anyway, actually we are listening about the adult, we are listening about the problem of the children, we are listening about the problem of the teenage. একটুখানি চেঞ্জ করে দাও। হ্যাঁ, less about the old age একটু চেঞ্জ করো, আমি মূল বিষয়টায় চলে যাই, বড্ড ডিস্টার্ব হচ্ছে। হ্যাঁ, so the main thing is that why in this pandemic situation, and what are the precipitating factor for the old age people, why they are suffering and what kind of problem they are suffering from, and what are the precipitating factor. Because this pandemic situation, there are a lot of precipitating factor. For children, their precipitating factor, they have the different color of the problem. The adult, they have the different taste of the problem, different color of the problem. And the adolescents, they have the different types of the problem. Already Mr. Dasgupte, he has nicely described what is their problem. Their problem is absolutely different from the adult problem. An adult problem is absolutely different the child or children, the problem of the children. So every population has their own, their problem has their own characteristics. But old age people, like, their precipitating factors is, in my consideration, the one of the all these are the factors. The precipitating factor means which is known as stress factor, which create stress, distress. So social distance, lockdown, mask, sanitization, all these are the new normal articles. All these are the new normal articles are precipitating factors for old age, because we have adopted social distance, we have adopted lockdown, we have adopted mask, sanitization. All these are the part of the life. But for old age people, at the end part of the life, it is very difficult for them to adapt all these new normal articles to continue their life, because it is difficult for them to change their regular lifestyle, to change the rhythm of their life. So it is a great factor, because I have talked when Koushik has talked about this webinar. So I started talking with the oldest people. So they are telling that mask, I'm not habituated with mask because I cannot breathe with the mask. Lockdown, I cannot morning walk, I cannot do evening walk, even I cannot interact with the people at the next door neighbor. So there is no social interaction has been cut down. No morning walk, no social walk, no social interaction, and the sanitization and repeatedly washing hands. So all these are the precipitating factor, and everybody is forcing them to maintain this new lifestyle, but it is really a difficult situation for them in this pandemic situation. They are the people, they are not like us, not like the common people, not like the young people, and they are suffering a lot. Each and every pieces of new normal articles like social distance, lockdown and mask, all these are maybe it is we are trying to adopt, but it is for them it is a very difficult, and it is creating a lot of psychological stress, distress. Please কেউ একজন মাইক্রোফোন টেস্ট করছেন, প্লিজ স্টপ ইওর মাইক্রোফোন টেস্ট, at least আমার বলাটা হয়ে যাক, দেন নেক্সট একটু কৌশিক চেঞ্জ করে দাও। কৌশিক হেল্প মি, নেক্সট স্লাইড প্লিজ।
Some changing the next slide.
এখানে আসছে না কিছু, বুঝতে পারছি না। একবার আগু পিছু করে দাও তো, বাট জাস্ট গো ব্যাক এন্ড হ্যাঁ এবারে ঠিক আছে, হ্যাঁ ওকে। এটা কি তার মানে ওইটার পরেরটা আমি ঠিক বুঝতে পারছি না।
Yes sir, yes sir, yes.
So this is also another precipitating factors. This social distance and lockdown both also causing psychological distance. Social distance is always old people, they feel like a kind of proximity with their grandchildren. Not only that, with their own children, with the family member. Always they feel like there is a word in psychology, the proximity, feeling like the nearness. I feel like to go near to your body. So old age people, this social distance is causing the huge amount of psychological distance, because the grandchildren, they have been restricted for moving here and there. Not only that, the own children, those who are adult, they are busy with their own problem, because all the adult, they are in a crisis because of the job, because of the salary, because of the new lifestyle, because of the safety and security of the family member. They are busy with themselves. They are preoccupied with a lot of different types of thoughts and different types of crises. They are not very much focused towards the old age people, towards the parents or grandparents. So lockdown also, it is causing also psychological distance among the family member, particularly from the side of the old age people. They are in a crisis, and all these are the precipitating factor, and continuously it is causing psychological stress. Next slide, Koushik. Another precipitating factor, this pandemic situation, particularly COVID-19, thus this new normal life, it has destroyed the normal rhythm of the life of the old age population. It is true.
Sir, your microphone is muted, sir.
Yes. Now you can hear me, I think so. Koushik?
Yes sir, you can audible.
Yes. So precipitating factor, it is the normal rhythm of the life of old age population. It is also very much hampered and disturbed and jeopardized the old age life, because their life is much more stereotyped. It is not that they are going for marketing to mall, or they are going to enjoy a cinema, they are going to, it is not that. Their life is much more restricted. Even the COVID-19, this pandemic situation, it has imposed more restriction to their normal rhythm of the life, the more restriction. And they are thinking, and the old age people, they are considering that we are in a jail and we cannot see even the sky. So this pandemic situation, it is also the most important and the precipitating factors for them, this pandemic situation and losing of normal rhythm of the life. Next slide, chole jai Koushik. And the precipitating factor, another precipitating factor is family members' gloomy face, because child, there also no school, and online, the studies studies through online, it is the new experience. They are not accustomed with that. They are not familiar with that. And not only that, being a psychologist, most of the time, I am hearing from the parents that my child showing aggressive behavior. So aggressive and irritating behavior, because child, they are also worried about themselves. They don't know what is happening. They are not much aware about like us. So they are also facing problem. And not only that, the parents, they are also facing problem, and we have lost to smile. Most of the faces are gloomy because parents, they are busy, they're preoccupied with their own problem. The father is busy with their own problem, mother is busy with their own problem, child don't know what to do and what not to do. So ultimately, all the family members, they have forgotten to smile. So gloomy face, it is very much contagious. The sad face and sadness and gloomy face, it is very much contagious. Please, any family member, particularly the woman, chole galo shop, Koushik. আবার এসছে তো gloomy face, it is the dangerous article, dangerous elements, dangerous instrument, because the sadness particularly, and the depression and the anxiety, all these are very contagious. So gloomy face, any old people, old family members, when they are looking at to their children, so all the faces are gloomy. So consequently, they are also becoming sad, and they are also suffering from frustration, suffering from stress, suffering from anxiety because of this gloomy face. It is also another precipitating factor, and in this pandemic situation. Next slide, Koushik. And another most dangerous aspect in this situation is the media hype. Media is focusing one thing: the old people, they are the most vulnerable. About old age population are much more vulnerable to COVID-19. So media hype is so extremely. Not only that, because if you go through the net, you will be finding the old age people, only the COVID-19, only the coronavirus, they are only slapping on the face of the old age people, and they are kissing all other people. It is something like that. They are slapping on the old age face of the old age people. It is something like that. This media hype, it is also causing the dangerously. It is causing the tremendous psychological pressure on the old age people. Next slide, chole jao. Koushik, next slide. সব উড়ে চলে গেল, আর দেখতে পাচ্ছি না। হ্যাঁ, খুব ছোট হয়ে গেল, এটাকে বড় করা যাবে? এনিওয়ে, ঠিক আছে। হ্যাঁ, so this media hype that old age people, this is true. Comparatively, the old age people, their immunization or immune power is less. That's why they are more vulnerable. This is true. But media hype is, they are exaggerating in such a way. So only the old age people, they are the victim of the coronavirus, and no other person is suffering from the corona at all. So it is causing tremendous, it is extremely frightening and fear-inducing, this media gossip. This media gossip extremely causing frightening the old age people, and it is also the old age people, they are very fearful just because of this gossip. So it is causing fear, and it is causing frightening to the old age people. This media is also playing the important role they are also playing the important role as a precipitating factor or distress factor. Next slide, chole jai, Koushik. The old age population by default, because of their the psychological slowness and because of their physical slowness, by default, because of the age, the aged people, those who are philosophically very strong, they are the exceptional people. But most of the people is not that they have the wisdom to fight back with the life. But the common people, by default, they suffer from insecurity because of the old age, because of the physical slowness and psychological slowness. They feel each and every moment they feel like I'm not carrying my young age, I'm not carrying my the fresh mind, fresh brain. So everywhere and all aspect they are a little bit slow, and they suffer. They start. It is a geriatric problem, the suffering. Suffering from insecurity. It is a geriatric problem by default. Next, chole jai, Koushik. So consequently, because of this, because of the pandemic situation and because of this, the problem of by default, all these reasons, they are the more susceptible to feel socially isolated. Because there is an insecurity and their own children, they are not careful like previous because they are busy with themselves. And they feel, the oldest people, because of this COVID-19, they are feeling that they have been socially isolated because there is no social interaction. They lost their normal, the rhythm of the life. Not only that, family members all are living like all are the individual island. All are busy with themselves. Everybody is preoccupied with their own problems. So if there is a 5-member, means 5 island. So old age people, they are thinking that I am socially isolated, and they are suffering from, or they are experiencing badly they are suffering from loneliness, and they have a very strong feeling of they have been isolated. Next slide, chole jai. And the coronavirus, the environment, this particular environment, and constantly this environment, this pandemic situation, and the TV program, and the newspaper, and the corona, because everywhere is the corona, this pandemic situation, and this corona environment constantly. It is playing a role of trigger. It is constantly triggering this negative feeling of isolation, negative feeling of distress, negative feeling of stress. Constantly, it is triggering the old age people. Next slide, Koushik. This is the reward from corona, or the reward from COVID-19. Reward for old age. Corona has given reward to old age people is number 1, insecurity, number 2, fear, number 3, anxiety, number 3, loneliness, number 4, stress, and of course anger. All these are the major issues. All these are the major complications the old age people, they are suffering from. And it is, we can consider this is the gift of the coronavirus given to the old population. Next slide, Chole. So we discuss about the problem. But what is the solution? It is so we should have focus towards the solution also, or the how, what will be the management to provide safety and security of our old family member or senior family member. So we can discuss something about how we can manage and how what are the things we can provide them to provide a little bit comfort. So next slide, Chole. The management. The first important point. It is not for old age people. It is for every family members. It is. I'm not right now. I'm not talking about the old age people. So every family member, we can pass through. We can lead a happy life. There is a very small elements. There is a very small instrument. The showing positive smiling face and personal body touch. Body touch is very important because we are Indian. always we feel like to touch to our beloved one. It is our habit. It is very much instinctual, and genetically it is endorsed. We like to be touched, and we like to touch to our beloved one. If I meet with my mother, I will not maintain the social distance. I will touch my mom's hand. I'll catch the hand of my mom, because it transfer the warmness. It transfer the quality touch speaks a lot. So old age people, they must be touched. Forget about the social distance. In home, forget about the social distance. I can touch to my old father. By one hand, I can touch to my grandfather by other hand. This touch is very important, and it should be quality touch. It is not that Partha Roy mentioned in a webinar. So that's why tonight I went to my father, I went to my grandfather, I am touching my hand. No, touch from it. Touch from the hand of your heart, not just a mere touch. And the smiling face. Smile, there are two types of smile. One is Dachini smile, another one is non-Dachini smile. Dachini smile means when you are smiling from heart, that is known as Dachini smile. That means your teeth will come out. There will be a crow leg at the corner of your eyes if your smile is true. So this is, in this pandemic situation, smile can provide a lot of happiness, because there is a science. It is not that I am telling you. It is not that. There is a science of psychology. Why smile is important. And the true smile, Dachini smile, show your teeth. And there must be the lips. There must be the crow legs at the corner of your eyes. If your smile is coming from the heart, it is necessary in this pandemic situation for all the family members. If mother is smiling, father will smile. If mother and father is smiling, children will smile. If the entire family is smiling, my old father, my old mother, my old grandfather and grandmother, they will also participate, because there is a science. Everybody will start smiling. And smile is a medicine. Why? Change kore dao, Koushik. Because smile, who is smiling and who is observing the smiling face, both of them, their body secretes the endorphin. Endorphin is the happy hormone. If you are smiling, your body is secreting endorphin. And if I see your face, and if your smile is really Dachini smile and true smile, then my body will start secreting endorphin. And endorphin is a happy hormone. In this pandemic situation, we need endorphin. It is not for the old age people. It is for the young age people, adult people, and of course for the old people, to smile and to show the smiling face. Because of endorphin, without any investment, we can enjoy the endorphin. You don't have to purchase from the market. It is zero investment. Smile from the heart. It is necessary for the management of creating happiness among the family members. And of course, the old age, the old grandfather and my old parents, they are also the family member. So also we can make them happy with smile. So next, chole jai Koushik. Endorphin is a good source of happiness, but both the person who is smiling, he also enjoy happiness, and who is also observing, that person also enjoy happiness. Both the person, the observer and who is smiling. Next, Koushik, next. And management and help to initiate to do something new in home. You help to the old family member, help them, support them to do something new. You think something new means they can start gardening, because still the top is available, the mitti is available, and the plant is available. So they can start gardening. They can start aquarium in the home.
Sir, your microphone is muted, sir. Sir, sir, your microphone is muted. Sir, sir, your microphone is muted.
Yes, yes, yes. So in this, I think now you can hear me. Koushik, can you hear me? I don't know why it is repeatedly. So the another initiative we can take. You can help to the old parents, and you can help to your old family member. Let them do something new. They can start gardening. They can start aquarium. They can purchase birds. So it is also it will also provide a purposeful life for them, because in-house lot of things we can help them to do. Lot of things can be done. They can learn origami. They can learn the bonsai. There are so many things we can help them to do. So it will be a good initiative to provide them a purposeful life in this pandemic situation. Next slide, chole jao, Koushik. Management that help to familiar with the digital world and provide guidance. It is also a ready resource we have. The mobile and desktop and laptop, most of the family nowadays, this is true, that in village area it is all these are instrument is not available. But at least we have some mobile. We can teach them how to do the Facebook, how to do the Twitter, Instagram, because every old people, they have some potentiality. So they can go for social media. They can make their own platform. They can do over there something. So this, or they can start blogging if they have the writing ability. So they can start blogging. All they can do from the home. And digital world, there are a lot of things, the entertaining things are there waiting for the old age people. But thing is that we have to guide them to be involved with this new instrument and new world. So they can also enjoy a new life from this aspect, from this area. Next touch, Koushik. Another thing is that the get-together session every day and spending quality time. Get together. It is not that the parents, they are busy with their children. Grandparents, they are busy with the spiritual thoughts. No. There will be a session every day, get-together session, and if you spend quality time for 30 minutes, lot of gossiping and spending quality time, it can also provide happiness among the family member, because nowadays we have forgotten to spend timing, because we are spending timing more or less all together. We are spending timing 24 hours, but we are not spending quality time, because everybody in home, everybody is busy. The girls, they are busy with the household and the trivial things, and the children busy with the studies and all, and father is busy with money management. Father is calculating how to purchase vegetable and when and how, and there is always an hide and seek game with the lockdown. So everybody is busy and preoccupied with their own responsibilities and own duties, and we are spending under a roof, we are spending 24 hours time. But think about that. What is the time frame you spend all together? You spend the quality time. To arrange a quality time, maybe it is for 30 minutes, maybe it is for 40 minutes, maybe it is just for 25 minutes. Stay together, everybody just gossip, spend some quality time, touch each other. So it can provide it can be a good source of happiness among the family member. Not only that, next it also helps create bonding, because COVID-19 mostly destroyed this important quality of our life, that is destroyed the bonding among the family member. So spending quality time all together, it helps us to enhance the family bonding. That is the most important the elements we need right now in this pandemic situation. So next I চলে যাই আমার মনে হয় যে আর আমার so thank you everybody, see you again. এটা নিয়ে যদি কারোর if you have any kind of question I'll give the answer.
Thank you, sir.
Koushik. Okay.
For the nice speech. And your PPT was really very nice. If you have any questions, participants, you can put them. No, sir, there is no question.
Okay. So
Thank
can I
you
leave
once
now?
again, sir.
Yes.
Sir, just a minute, sir. Before wrap up our webinar, I want to express my heartfelt thanks to our all speakers. Professor Sadhan Dasgupte, Department of Applied Psychology, Calcutta University. Dr. Sreemoyee Tarafder, Department of Psychology, West Bengal State University, and Mr. Partha, Clinical Psychologist. Thank you so very much, sir, for your valuable knowledge and idea. We are really enriched. And I also express my heartfelt thanks to our Principal, Sir, Dr. Jaydeep, Sarangi, and our Vice Principal, Sir, Professor Dibes, Bera, and IQAC, Dr. Sanjukta. And I must mention my deep sense of appreciation for Koushik Das for the technical support. Thank you, Koushik, for all. Thank you, sir. Thank you all the participants for being with us. After completing the feedback form, you will get the certificate.
Prakash, do not stop streaming. Prakash, do not stop streaming in YouTube. Please, Prakash, can you hear me, Prakash?
Prakash.
Yes, ma'am.
Please send a feedback form in YouTube.
Excuse me, sir.
Yes.
Sir, on YouTube, the program has already ended. So I shifted back to Google Meet right now.
I'm
Okay.
sending feedback form again. You can fill.
Okay. Can I use on Google Meet feedback form?
Yes, sir. Yes, sir. You can.
Okay. Thank you very much. Thank you. Hello, sir. Can you listen me, sir?
Yes, yes, sir.
Sir, in the feedback form, there is an option for writing university name. Actually, I am an economics teacher, and what should I write in university name?
Sir, you are in a university? Money, you are in a institution, sir?
Yes, sir. I am a economics teacher in a school.
Oh, school.
Yeah.
Okay.
So you write the board.
Okay, okay.
Yes,
CBSE.
sir, yes.
CBSE, right?
Hello, sir.
Yes.
Hello.
Hello, sir.
Yes.
I
Yes,
am a
yes.
student. I am a chemistry honor student. What do I write in the organization name? My college name.
Then your college. You write just your college name.
And
Okay.
university name also my college name.
Institution. You write your college.
I will write both the name, both college name in organization and college. University. Thank you.
Okay. Yes.
Thank you, sir. I am from Odisha.
Okay. Prakash, can you hear me, Prakash?
हेलो
प्रकाश।
यस बोलिए सर।
कुछ लोग बोल रहे कि वो ज्वाइन नहीं हो रहा पा रहे।
नहीं ज्वाइन तो हो रहा है।
हो रहा है ना? ओके, फीडिंग
हाँ, yes.
बंद मत करना। हाँ
यस यस